Hey, Harvey Elwood, we're back here at the Regional Medical Center to talk about some of the important programs that are going forward. As you very well know, some 3 years ago, we did not have a pathway to behavioral health operating here at the Regional Medical Center. In the short span of 3 years, we are there now, and we're doing a fantastic job, greater than ever before, leaps and bounds beyond where it has been. And this is a very important service to the community. Behavioral health, of course, as you know, are those people in some instances who've fallen through the cracks, some in the area of dementia, some in the area of other behavioral health issues that I'm not an expert to talk about, but I can ask questions of Dr. Valerie Holmstrom, who is the director of the Pathway to Behavioral Health Clinic. Mm-hmm. Is that right?
That's right.
Welcome back to our program. And give us an update, if you will, about where we are in terms of your program and the progress that you guys are making.
Well, we're just entering into our third year, and we have a clinic which is in the Medical Arts Building right next to the hospital. We are an arm to primary care at the Regional Medical Center, and also to other primary care practices in the community.
Lexington, those that are in the surrounding areas?
Surrounding areas, including the pediatric practices. We have 4 providers in our clinic. Myself, Dr. Reuben Ridgway, who is also a clinical psychologist, Ms. Elizabeth Ridgway, and Ms. Edith Belly, who are both licensed professional counselors. We're seeing a wide age span of clients from 3 to 88 at the present time. We didn't anticipate, actually, that half of our patients would be in their 60s or older. But
why are we there? Why are we seeing so many patients that are in older age areas?
Well, people are living longer, and as people move into later life issues, they have special stressors, declining health, sometimes loss of family members, financial stressors, things that contribute to anxiety and depression in that age group in particular. And I think people are more willing to get help now than in times past.
It's not such a stigma attached to mental health issues.
That's right.
And of course there are some pathways to improving one's mental health and condition. And I guess that's why they come to you guys. That's why they come to your office. What are some of the most pressing behavioral health issues that you see that you come in contact with in your office?
The majority of late adolescent and adult clients are coming for evaluation and treatment for anxiety and depression. With small children, it's more often behavioral disturbance. Parents are involved in the treatment process, and sometimes we're doing parenting training, trying to help them with more effective methods of discipline, developing skills in more appropriate supervision of their children. But also we see children who've had major traumas, and that's not unusual.
Sure. It's important because things that happen early in life to a child will, if not treated, may carry on into adulthood. Is that correct?
Absolutely.
And in some instances, people who may have been abused, let's say, oftentimes may grow into become abusers if they're not treated.
They may grow into abusers, and also we see adults who've never gotten help with abuse that they've suffered earlier in life, and they carry depression and anxiety symptoms associated with that.
What basically is the volume of client, would you say? Is it in thousands, is it hundreds, or is it low numbers? Is it...
You mean how many clients at any one are in our pool at any one time? I actually don't know that number. Okay. Typically our appointments are for about 45 minutes to an hour at a time. We see some patients on a weekly basis for a period of time and then less often. Some of our work is more crisis-oriented. We might see an individual just for a few sessions.
Some of this, some intervention takes place. I know that Costa Family Systems, for example, has to probably work very closely with your center because they are the crisis center for battered women
Yes.
or battered individuals. So I know your office may interact quite a bit with them.
Not a lot, but they refer people who need more ongoing therapeutic services or cases that are more complex than what they're dealing with from a treatment standpoint.
And the courts as well? The courts, you get referrals from court?
Yes, we get referrals from family court. Some of those are Department of Social Service cases. Some are family court cases, might be related to alienation, where a couple is divorced and one parent is perceived as alienating the relationship of a child or children from the other parent, and family court may require that that the parents come for assessment and that treatment recommendations be made and followed.
I see. Opioid addiction is very high on the radar in the news.
Yes.
As are other substance abuse problems, as well as alcohol abuse. Is the center involved and engaged in any treatment in those areas?
We are more indirectly. We see patients who are suffering from addictions or drug dependence who we may refer to the Dawn Center, the local substance abuse program, for assessment and treatment for that aspect of their problem. But we may also be involved with the same patients providing treatment for depression and some relapse prevention treatment related.
So they don't
addiction.
fall back into the addiction.
Exactly.
Vocational rehabilitation, another state service, which works to help people get back into the workforce. Are you guys involved with them at all?
We make a lot of referrals to Voc Rehab for patients who need assistance with vocational rehabilitation.
Okay. Well, you cover a wide range of things. So we've got depression and mood disorders, anxiety disorders, adjustment disorders. Exactly what is an adjustment disorder? What is that?
An adjustment disorder is a disorder that is considered more transient but related to recent or current life stressors.
Okay.
So if someone's going through a divorce, they might have clinical symptoms of depression, but they also need assistance with dealing with the stress, how to cope with stress.
In some instances, doctor, some people have repressed anxieties, things that they've put in the back of their minds or subconscious. Do those things still affect people?
Absolutely. One of the symptoms that might be associated with that is panic attacks, and we do receive referrals and treat folks with panic disorders. Those people sometimes think of their problem as a physical one. They might go to the emergency department with concerns that they might be having a heart attack, and indeed they're having physiological symptoms, but it's not a heart attack.
It's rooted in somewhere in the recesses of the mind, I would imagine. Well,
they might not be aware of what's triggering the attacks,
Gotcha.
and the therapy consists of both helping bring into awareness the emotional factors they're not dealing with, and also teaching techniques for managing the symptoms, relaxation and breathing techniques.
Okay, and that's what you guys teach, a part of what you teach.
Yes.
Okay. All right, so we've got bereavement as an area of concern, particularly for senior citizens and older adults, and children. Some children have anxiety when it comes to the loss of a parent or a loved one, grandparent.
Yes.
I myself dealt with that. I lost my parents when I was very young, but we've been able to, I believe, overcome and use it as a positive and something very good. Post-traumatic stress disorder. Can you talk to us a little bit about
Yes.
it?
Well, post-traumatic stress disorder is a disorder related to trauma, either life-threatening trauma or fear of threat of one's life. And we see that disorder, it was first understood with veterans, military combat veterans, but we also see that now with people who've suffered from disasters or been involved, witnessed a shooting, been involved in some other kind of life-threatening situation, victims of rape, sexual violence or aggression. And what happens is the person actually develops a set of symptoms to try to protect themselves or ward off
Coping mechanisms.
and the symptoms become a problem.
I see.
Being hypervigilant, always on edge, afraid that something's going to happen, withdrawing from people socially, being afraid of making attachments for fear of the loss of attachments, those kinds of problems.
And that's why this clinic is so valuably important. This is the pathway to behavioral health at the Regional Medical Center. My name is Harvey L, and of course this is Dr. Valerie Holmstrom. She's the director of the center, and they deal with a plethora of information. Well, they provide a plethora of information, and they have a lot of things they're dealing with to help citizens of this community and beyond. They can be reached at area code 395-3715. That's area code 803-395-3715. Is that right, Doctor?
Yes, that's correct.
And of course, they're located at the Cook Road facility, the Medical Arts Building, 1175 Cook Road. You can find them, and they're open Monday through Friday. I'm sorry, the hours of office are Monday, Wednesday, and Friday from 8:30 till 5 p.m. and Tuesdays and Thursdays from 8:30 a.m. until 8 p.m. So you guys have some late hours.
Yes.
Okay. Anything else that we need to know? Anything else you'd like to tell the audience and let people know about?
No, I don't think so. I would want people to understand that we work closely with other providers in the community. And we are not a replacement for the mental health center by any means. They serve the more chronically mentally ill and have...
So you guys actually do referrals to them as well?
We do referrals to them. They make referrals to us also.